Hey everybody, it's Laura. I wanted to talk a little bit about what's going to happen next week with our students where we're doing their midterm assessments. Um, this is kind of a new thing. Obviously, it's all new, but next week they're going to actually be doing individual simulations, little mini simulations where they're going to be checking off on some things individually as opposed to their group work, which we have been used to them doing. And so I kind of want to just run through how that's going to work. I have also completed a video for the students, which kind of walks through what they can kind of expect. And that video is intended to serve as their pre-briefing so that we don't have to do any pre-briefing for them when they come in. And that's kind of been taken care of. The only thing that you might have to do as a pre-brief is if there's anything specific about the mannequins that they are working with, because some of these mannequins may have voice capabilities, or they may be able to listen to breath sounds and things like that. So when we get to the rooms and we know which mannequins do what things, which we may not know until next week, you may want to explain that to your students before they get started on their specific assessment. Other than that, everything else has been covered in the video that I'm posting for the students. But I want to share my screen and show you guys. So when the students come in, they will have an iPad and a scanner in their room because they will be able to access a chart for their patient. And they will also have this little piece right here in their room. So this will serve as their report or a little synopsis of the case. This part, the setup piece, that's just there for us to know what's supposed to be set up, as well as the lab people to actually do the setup for the patients. But this part up here is what they're actually going to get as their kind of introduction. And so I will have these there, like on a piece of paper for the students to read, and they can just read that on their own as well as access the chart, because this information will also be in the patient's chart, bits and pieces of it, as well as the orders. So like any medications that they need, or if they have orders for oxygen, or orders to insert an NG tube, things like that. Those things will be in the patient's chart. And so they will be able to, what they are expected to do is come in, engage with their patient, identify their patient, introduce themselves, talk to their patient, assess what's going on with their patient, and determine what the priority needs are with their patient. And then determine what interventions they need to do. If they're, for example, if Sue was their patient, they would need to go in and determine that she needs to actually have um, medications given via her NG tube, as well as this IV piggyback given. And those, before they do that, they obviously need to check placement of the NG tube before they give the medication, the baclofen, and then they need to properly give this IV piggyback medication. Those are the two things they are doing for Sue. Once they have done that, they would then document their care. The other thing that the students are being told is that they need to document an EHR tutor, but that if they do everything, they have 30 minutes to complete this assessment. If they need more than 30 minutes, if they need more time to document beyond the 30-minute time frame, they can go into another room and finish their documentation. I don't care if they get that documentation done in the 30 minutes or not. They can have a little extra time if they need that for the documentation. Um, each of these cases has an evaluation tool. So we were just looking at Sue, so I'm going to show you what Sue's not documentation, evaluation sheet looks like. So we're using the Crichton tool to evaluate. And so each of the Crichton tools is specific for the case that we're talking about. So for example, for Sue, they would need to assess that she has meds due. They would want to assess the IV site before they gave that piggyback, NG placement before they gave the NG meds. Any follow-ups is the environment, assess the environment, um, checking NG2 placement, um, working the IV pump, things like that. You can see I've already put what is not applicable as well. And then down here, you can see what specific scores get them an A, a B, a C, and then if they don't pass, then we would want to remediate and repeat with them. The schedule finishes up a little bit earlier than when we normally do. So we should have, if we have people who don't pass, which I really don't anticipate that happening a lot, we should have time to do remediation and let them repeat the same day if they want to. What I have explained to the students when it comes to these specific skills, like the NG2 placement, the bagging, the Foley insertion, things like that. I am not expecting them to follow like some 20, 30 item skills checklist. We all know the proper steps for doing these skills. I'm really looking for, there are more than one way to skin a cat here. I am okay with them doing these things as long as they maintain the general principles of safety, of asepsis, of sterility when it's something that needs to be sterile. As long as they maintain those general principles, I'm okay with that. So we're not using it, we're not checking off multiple items as they go through these things. Look for them to be doing it in general correctly and maintaining those general principles. If something is way out of whack, then we have a problem. But we're we're not going to be using checklists for these skills. I think those are the major points. I will print off these CCI tools for everybody and have them ready for you and waiting in your rooms. I told the students, so we're going to be in the room with them and evaluating, and we will serve as the voice for the patient and to provide any additional assessment information that they maybe are not able to ascertain from the mannequins. And I think that's it. We won't need to be using monitors and stuff, I don't think, from these patients, because the students will already have their vital signs, and these are static situations. They're not going to be changing. So we won't need to put them on monitors and all those kind of things. Again, these are simple stationary situations. So, and they're meant to be quick. Let me know if y'all have other questions or if I'm forgetting something, but I think that covers the majority of it. So, yeah, let me know if I'm forgetting something. Um, as always, thank you guys for your help, and I'll see y'all next week.